Hi everyone, we'll get started in a minute. We'll just get everybody in from the lobby and then we'll kick off. Okay, good afternoon everybody. Welcome and thank you for attending the 4th National Clinical Pathways webinar. For most of you, you will not know me. I'm Jen Wilson. I'm Head of Programmes within CFSD and I'm going to be facilitating the session today. These webinars are designed to showcase the pathways that have been developed by CFSD in collaboration with our clinical communities, and these are hopefully going to provide a forum for education, some informal discussion and some Q&A after the presentation. Before we get started, I'm just going to cover a little bit of housekeeping for the session today. So these webinars will be recorded and they will be made available on the CFSD website at a later date. There will be an opportunity to ask the presenters questions at the end of the session. You can post questions throughout the session and the presentation, and you can do that by using the Q&A function that hopefully everybody can see at the top of the screen. If there are any pressing urgent questions that you want to ask as we are going through the presentation, we would just ask that you please use the raise hand function and we will unmute you and ask your question at that point. And the final thing in terms of housekeeping, we have got a couple of videos to play in the presentation today, and there are quite a few people online, which is great to see. So we would just ask anybody that's not presenting to keep your camera off throughout the presentation, and that will just make sure that the bandwidth, etc., is okay for the videos. So we're here today to talk about the new digital dermatology pathway that is currently being rolled out across NHS Scotland. So before we kick off, I'm just going to introduce the other presenters that are here with me today. So in addition to myself, you'll also hear from Dr. Becky Cheeseborough, who is a GP in NHS Lothian and also one of our primary care clinical leads for the programme. We've got Stephen Lamb, who is the account manager from Consultant Connect, our supplier, who has worked very closely with us through the development and implementation of this. And last but not least, presenting, we've got Anna Armstrong, who is our service owner from NES Technology Services, who has been instrumental in the design and development of the solution itself. Not presenting today, but part of the team who are going to be helping to ask some of the questions that will hopefully come in. We've got Jessie Russell and Craig Miller, who are our project managers that some of you may be familiar with as they work very closely with the health boards through the delivery. So digital dermatology, I'm going to kick off, just give a very brief overview of the programme, why it was brought to Anya, and then I'll hand over to Becky, who will go into it in far more detail from a clinical perspective. So dermatology is the third biggest specialty in Scotland, and there's over 2,000 diagnosable conditions. Suspected skin cancer represents approximately 50% of the workload for special dermatology services, and we know that photo triage is absolutely crucial in the diagnosis of skin cancer. Case studies show that a digital image as part of a referral can help secondary care clinicians triage patients more efficiently and more effectively. But to do this, there needs to be an easy, safe and quick way to do this within primary care, capture the images and attach them to the dermatology referral. And that is what this pathway is trying to solve. So the Consultant Connect app that was procured is an image capture app that is able to be used on clinicians' own devices. And this enables primary care to capture images at the point of referral. The app is the true meaning of pass-through, so it does not retain any images or any data on the user's device or the cloud, and that makes this IG compliant and clinically safe. The app has been further developed to also integrate with NHS Scotland, and we'll hear a bit more about that later on, but it does integrate with Kyle-Lookup and Sky Gateway. So as I've touched on, Consultant Connect are the supplier that we have been working with. They were awarded the contract at the end of 2023, and that was done through an open procurement process. The pathway is very much in the process of being rolled out at the moment. We began implementation with our early adopting health boards in November 2024. All 14 territorial health boards have signed up to use Consultant Connect, and that implementation is going on at the moment. This solution and pathway has been endorsed by all the health board chief executives, and this is a tool that's being offered to help and aid primary care to create more informative referrals into dermatology with images attached. I'm going to pass on to Becky, who is going to go over this in far more detail, and obviously the benefits specifically to primary care as well.
Thanks, everyone. As Jen said, I'm Becky Cheeseborough. I'm a GP, work within NHS Lothian. I suspect all of us on the call are very aware of the waiting lists within dermatology nationally at the moment. Certainly, we are very well aware of that within NHS Lothian. And I think it means that we really have to look for different ways to try and address the waiting times, and digital dermatology and sending photos referrals is certainly an important part of that. So for us as primary care clinicians, I think there are definite benefits in terms of sending photos. There are also benefits for our patients and indeed for secondary care too. So for patients, it should mean access to quicker advice for treatment. So this could be treatment that could be started in the community, or it could be reassurance about a lesion that they don't actually need it to be seen for. It means that we can triage patients directly to the correct clinic, or perhaps even directly to treatment, and rather than needing to see everybody in a face-to-face clinic appointment first. There are fewer face-to-face appointments needed, and that means less travel time for patients. And then ultimately, for those that do need to be seen face-to-face, they should get seen sooner. For us in primary care, it should mean higher patient satisfaction, and I think importantly, fewer representations of patients. So for patients who sit on waiting lists for long periods of times, we know that generally they will come back repeatedly about the same condition that they're waiting for. And then for secondary care, obviously, if we can send referrals with good quality photos, it does help to make triage more effective, and help at that initial point of kind of contact into secondary care. So in terms of using the app, it's actually really quick and simple to use once you've downloaded it. The benefit is that you can use it on your own device safely. So there's no having to use a shared phone within the practice. And importantly, no images are saved on our own devices. As Jen said already, it's fully information governance approved, so we don't need to worry about the security of it. It's a single sign-on, which means that you'll only have one password to remember. So that's your initial Windows password or an NHS password that you use to log in at the beginning. And also, it's the same referral pathway. So once you've taken the photo, it goes off to the national digital platform. You would still go about doing your Sky Gateway referral in exactly the same way. And at the point of sending it, you can attach the photo from the NDP. So the NDP should now appear as a tab when you press on attachment, and you just attach it to your referral, and it gets fired off on Sky Gateway in exactly the same way. I'm going to hand over to Stephen from Consultant Connect. Thank you.
Hello there. I hope you can see that the slide okay. I just just give you a brief introduction to Consultant Connect. We're a telemedicine provider. We work with health boards across Scotland, England, and Wales, for the entirety of Wales, in fact. We do other services such as telephone prof-to-prof advice and messaging. But for this National Dermatology Project, we are focused on PhotoSafe, which is our pass-through application, which allows IG compliant images to be taken. And with the developments we've made on the PhotoSafe version for Scotland, it allows easy transfer to NDP to obviously attach referrals easily, to attach images easily to referrals. We hope you find it easy to use and quite quick to understand, but we've got a very short video to show you how it actually works in practice. If I can just get on to the next slide. And I'll just play this for you. And obviously any questions you have about the practicalities of using it, please ask away, obviously at the end of the session. I hope you find that quite straightforward, and easy to understand. But obviously, ask any questions that you have at the end of the session. I'll now pass over to Anna for the next part of the presentation.
Thanks, Stephen. Hi everyone. I am going to show you first a demo of what the N10 looks like from a user's perspective. Oop, apologies, I think I accidentally hit play on that one. So first you're going to see someone using the Consultant Connect application to take a photo of a patient's hand. And next you'll see what that looks like from the Sky Gateway referral side. Not sure what happened there. I'm gonna try and scoot back to that part. Okay. I don't have loads of control over what timestamp that is, so I'm gonna just go back a little bit. Almost done. Okay, from what I'm seeing, it looks like the video is a little cropped, and that is actually where it ends. All we're missing is hitting attach, and then at the end of the Sky Gateway referral, for those of you who use Sky Gateway, you get a list of the attached images at that point. I think what we could do is put a link to the full-length video in the chat if anyone wants to see the last 10 seconds or so of that video. Okay, I'm going to keep going. Okay, so at this point, normally I talk about the reauthentication process, which was mentioned in that video. Because we are using an NHS Scotland application and process on our own personal mobile devices, there is just a little extra layer of security which is required for us to do that, and that is having to reauthenticate or log in or prove you are who you say you are within a 24-hour period. As the video mentioned, there is a spot to do this at the point of Chi lookup, so that's accessing NHS Scotland patient data. If users choose not to do that, or if they don't have the internet connection required to do that at the time of the Chi lookup, it's possible to do that from an email prompt or once internet is restored by swiping down on their profile. And then we do have a few different user types within the application. So we have what we call a practice clinician or practice admin. Clinician is our bog standard user role. That means that within the Consultant Connect website, you can only see data that you yourself have created. Our administrator role is able to see photos created by anyone within their GP practice. We've had practice managers onboarded in that, or administrators who might be helping with the referral process or moving photos around. Or if we have general practitioners who might be looking after or supervising medical students or doctors in training. And then we have a national reporting role. So this is not somebody who would be taking photos, but from someone from a health board level who would be interested in seeing reports based off of the sessions created. Okay, and then normally we usually ask, can you use this offline? So as I alluded when mentioning internet connection, yes, absolutely. This was quite important to what we were hearing was quite important from our users when we were developing this. Say if GPs have low internet connection in their GP practice, that's cut for whatever reason, or if they're doing house visits where there isn't great connection, you can take multiple pictures, multiple encounters, so see multiple patients while being offline. And as soon as you are online again, the pictures will be queued up to send. Additionally, Consultant Connect worked with us to do a little bit of validation around that Chi lookup or Chi process. So even if you don't have internet connection, which is required to go fetch those patient demographic details, the application will check the required formatting of a Chi number, and if that is off, prompt the user to try again, which I think is pretty neat. Lastly, I think in the website we're about to send you in the chat, or if that's done already, you can see, we do have a technical troubleshooting page, which allows users to have a search at the most common questions we're getting. Normally that's around logging in or reauthenticating. And there is some pretty good guidance there on how to help yourself out with that. And I leave next, I'm passing over to Becky to chat about best practices for image capture.
Thanks. So our colleague Lucy, who unfortunately can't be with us today, she is a medical photographer in NHS Fife, and she's put together some really good guidance and tips about taking quality referrals, which actually really enhances the referral and the ability to triage the referrals. I'm going to run through it now. It's also available on the training and education pack on Turas 2. So firstly, the important thing is to gain consent. So that's verbal consent, usually from the patient. Just explain why you want to take the photos, and also just explain to the patients that no images are going to be saved on your device and that it's completely secure. It's useful just to give the area that you're going to take a photo of a quick clean if needed. So this is probably especially important if you're taking a photo of a lesion or something on the face, because you want to get rid of makeup or something that could mask the colour or change the pigmentation of the lesion. It's helpful to remove any distractions from the image, so things like jewellery or hair or clothing, and then place the patient next to a plain background if that's possible. So it could be the wall if it's a fairly neutral colour on the wall, or even a piece of the paper roll from your couch in the room, and pop that under the body part that you're taking the photo of. And then try and use natural light if possible. Obviously, it depends on the room that you're in. But this helps to avoid shadows and does make it an easier picture to look at. If you haven't got enough natural light, then turn on the lights. That helps too. You may find also that the device will just automatically turn on the flash if it feels like you need it, because the more available light that there is, that really helps the autofocus function on your device. So you probably want to send a minimum of 2 photos, but probably ideally more than that. So firstly, you want to take and establish an image, and this should really clearly document where on the body the area of concern is. The second image is going to be a close-up, and this is to capture as much detail as possible. So you want to move in closer when taking that photo and allow your device to refocus as you're doing a more close-up image. If available, it's really helpful to have a scale. So putting something like a little ruler next to the lesion, or even something like just putting your thumb next to it, because it really helps in terms of illustrating the size. Extra images can be really helpful. So for example, if the lesion is raised, then if you move around slightly with your device and then take the image, it just gives more idea about the raised nature of the image and an idea of the height of the lesion. And then if you do have access to a dermatoscope and you're able to do that, then again, taking a dermatoscopic image and attaching that to is also really helpful. That's kind of a bonus, the dermatoscopic image. Actually, the other images are the really important thing to get sent. And then this slide really just gives an example really of a really good series of photos. So the first photo, the one on the left, so that clearly documents where on the body the lesion is. And you can see that the hair's been tucked behind the ear, so there isn't any distraction. There's no jewelry which obstructs view. The second image is much more close up. You can see that it's nicely in focus. There aren't any shadows. And then the third image along, they've moved the camera very slightly to show that that is a raised lesion and give you a bit more idea about the height. And then the final one in this series is a dermatoscopic image. I think that's the end of my, so I'm going to hand back to Jen.
Thanks, Becky. So this slide, some of you may have already seen this, just to give a little bit of a recap of some of the training and education materials that we have got that can be accessed through the TURAS page, and we can share the links for all of these following the sessions. We are offering drop-in sessions, which will very much take the format of this. So if any of your colleagues are not able to attend, we would encourage either to share the link once this recording is finalised, or we have got a training session coming up on the 13th of May, which, as I say, will take very much the same format as this. So there are those drop-in sessions. There are the short videos in terms of how to use it and how to set up. There's also written guidance on the TURAS page. So it's got sort of operating procedures, best practice guidance, the troubleshooting guide and FAQ that Anna has touched on throughout the session. That is all there on TURAS. If there is anything that is not there, or that you need some help and support with, there's also contact us on there to get in touch with the team. The other thing that we're keen to do, if it's helpful, is if there's any local meetings that you think would be helpful for us to come and present to, or provide a health board specific training session, we're also happy to do that as well. And we have been offering this out to the health boards as we have been implementing. They have been well received. So there's plenty of options there for people who like different variations of learning. It is very self-intuitive, so hopefully once people have downloaded and are able to log in, it sort of takes you through it step by step. In terms of what are we already seeing, I'm just going to sort of wrap up a little bit with some of the things that we're seeing through the health boards that have already gone live. So as I touched on earlier in the presentation, all 14 territorial health boards have now signed up to use this app. The later adopting health boards are taking a phased approach to local delivery across GP practices. So you may not quite have access yet. We have approximately 54% of GP practices across Scotland are now able to use the app and have full access to it. There's new practices coming on every week within the health boards. Since launching in November, over 2,000 of the Sky Gateway referrals that have been made to dermatology have had images attached using the new Consultant Connect app, which is great to see, and that number is jumping week on week. This is the first programme that has come through the ANYA pathway, so another thing that we are doing as we go through this process is actively reflecting on delivery and making sure that we take on board any learnings that we are getting as we go through this process to ensure that future ANYA programmes can be more efficient and we can have that continuous improvement as we go through. I'm going to touch now a little bit on what does the next sort of 5 to 6 months look like in terms of that look ahead. So as I've said, the rollout is ongoing actively at the moment with new practices coming online every week. The national programme team, which consists of those that have presented here today, but we also have secondary care clinical leads and additional primary care clinical leads. Everyone will remain in post until the end of September to really work with the health boards and provide that support. So over the coming months, we will continue to work with boards to finalise that rollout within your health board and really optimise uptake across primary care so that people are using this and there is that equitable service to all patients if they are being referred to dermatology. Another key focus is really improving that image quality, and we'll do that through that training and education from a focus from Lucy's perspective, and that really helps enable that effective triage once the referral gets to secondary care. Another thing as part of the pathway we're looking at is really embedding ACRT within secondary care across all health boards so that the benefits of this programme can be realised. As a sort of out with the current pathway, we are also looking at exploring extending the use of this image capture app to other specialties so that primary care can use this if they're referring to other secondary care departments. At the moment, it is only for use for dermatology. That is a question we get asked a lot, but we are exploring what that could look like because we are definitely seeing the benefits and we know there's a number of other specialties that are interested in exploring this and using this. Also, over the coming months, we are going to be looking at further developments and enhancements from that user experience. So particularly around about the digital, Anna and the team are looking to see how we can continue to improve that user experience of the application. Now, just before we finish, I would like to finish today by sharing a patient case study that I think really brings to life everything that you have heard over the course of the past half hour or so, and how this patient has actually benefited from the pathway. So the patient in question had attended their GP surgery 3 times with a progressing skin rash from October to November last year. It had several treatments from the practice, none of which had worked. On the 21st of November, the patient returned again to see their GP, who at that point decided it was time to make a referral to dermatology. The GP captured images using the Consultant Connect app, attached them to the Sky Gateway referral, and off they went to dermatology. The GP received a reply from dermatology just 24 hours later, so on the 22nd, with a suggestion for oral steroids, which the GP was going to try, and also a recommendation to try an oral antifungal, which was something that the GP hadn't considered. The GP was able to do the prescription, get in touch with the patient very quickly. The patient was able to start on treatment, and this resulted in the rash improving, and the patient actually hasn't been back at the GP. So a routine referral within that health board would have been at least 40 weeks, and the patient was able to get a response and commence on treatment within 24 to 48 hours. This has benefits, going back to what Becky said, for both primary, secondary care and the patient. So for the patient, they got very quick advice and guidance. They were able to start treatment and they didn't need to go to a face-to-face appointment or have a 40+ week wait for a routine appointment. For secondary care, there was no face-to-face appointment, meaning that if there was a referral that came in that would require a face-to-face, there's not a sort of in order process, that could go to somebody who really needed that more urgently than the patient in question. And for the GP, there has been no return appointment. So patient had presented 4 times prior to the referral with the images, and that patient hasn't been back. So it really does provide benefits to all of those that go on the journey across the pathway. Thank you very much for listening today. I'm just going to pop up on the screen a couple of QR codes. So the first one will take you directly to the TURAS learning site with all those materials that we've touched on. And the second one is the QR code that will take you to the app stores where you can download the Consultant Connect app. I believe these, we can circulate the slides so that everybody can get the QR codes. And we are happy now to take any questions. I see there's been a couple of things just popped into the Q&A. I think they have all been answered. Yes, Fiona Meredith looks like she's answered them, so great, Fiona. But are there any more questions or anything anybody would like us to cover? If we have lots of questions and we aren't able to answer today, there is an email address that you can get in touch and we will come back to you, but we will take questions just now. Jen Peebles from Fife.
Hi there, so I'm a GP in Fife, so we're currently using a different app for saving things into document and attaching things from there. It all seems obviously great for if we are actually wanting to do a referral. As GPs, we often don't do referrals for patients, but we want to save the pictures. And so when we present 8 weeks later, we can have a look and see has this progressed or not. How do we do that with the consulting set? Or if it's a different colleague, I appreciate what you've said is that I can see my own images that I've taken through the app. We don't seem to have access to the app yet in Fife for some reason. But how does it work if it's a colleague that's seen them and we've not actually wanted to refer?
Okay, so probably maybe between myself and Anna. So Fife, I'll just work back a bit. Fife will hopefully be going live across the board in May. We're working with Fife at the moment, so hopefully you should have access very soon to that. In terms of, I guess, that watch and wait scenario, you can still capture images and they go to the NDP. The National Digital Platform does not have a front end, but you would be able to access those images through the Consultant Connect cloud, is my understanding. I'm looking at Stephen and Anna to make sure that that is in fact correct.
Yes, I can jump in there. So we've had some similar questions in the Q&A, and as Fiona alluded to, we do have specific documentation on how to move images from the Consultant Connect website to your document instance, which is our understanding where most of our primary care clinicians would be looking for any watch and wait pictures. I should have mentioned earlier when discussing the roles on Consultant Connect, that is only within the Consultant Connect website, so it doesn't affect your Sky Gateway access. So in addition to the Consultant Connect website, you can also see all pictures taken in your practice from Sky Gateway, just like you would have on Document. But I will pop the direct link to the Document SOP in the chat now. So appreciate it is a bit more of a manual process for watch and wait.
Does that answer your question, Jen?
Yeah, I think so. I think we see when it rolls out, I guess, how easy it is to get things back from the platform to save them.
Thank you. David Miller.
Hello there, hi, I'm a GP from NHS Lothian. I was just wondering regarding practicalities of taking the dermoscopy images. Is there like a special device you have to attach to your phone to do that, or do you just simply place it up to the dermatoscope? Thank you.
Thanks, David. Becky, do you want to take that one?
Yeah, it depends on the dermatoscope is the answer to that. So within Lothian, actually now, David, pretty much most practices, if not all, should have access to a dermatoscope and an attachment that you can use to put it onto your mobile phone. if you haven't gone to your practice, then that's something I can look into for you. But actually, you don't necessarily have to use an attachment. You can just put your device, the camera on your device, up to the dermatoscope, and you can still take a decent quality dermatoscopic image doing that. So either, essentially. But I can liaise with you if you haven't got what you need in the practice in Lothian.
Well, that's fine. Thank you very much, Becky. Thank you.
Thanks, Becky. Any more questions before I move into that? Most of the questions that are being popped in the Q&A are being answered by the team in the background, which is great. John.
Hi, mine's is just a question about the KAI and the KAI lookup. So obviously I understand that the device can, or Consultant Connect can look up the KAI number and pull down the information of the patient from that KAI number. And if the KAI number's entered incorrectly, i.e. there's not enough numbers in the KAI number, then it'll flag it up saying try again. My question really is actually surrounding, if you enter the KAI number in with the right amount of numbers, but you just enter the numbers in the wrong order, and you don't double check the patient details, and then you upload it with the wrong patient details, when you go to obviously attach those files to your referral, that patient's name won't marry up with what you're looking for. So is there a way of changing the patient details once it's uploaded?
No, once it's uploaded, that would be a formal data correction.
Formal latex, right?
Yeah.
Okay, that's fair enough. That's fine. That's all right. That's all I wanted to know.
No worries.
Thanks, John. I see there's a question in the chat about areas that are currently using email to access secondary care advice. Is there a plan to move this to go through Sky Gateway? Daniel, that would very much be a decision for the local health board. So we're working with the health boards. I think I'm only seeing NHS age, so I'm going to make the assumption you're Highland. But certainly things like that would be significant changes to current process would be a decision for the health board to make, not for the national team to make. So I hope that answers your question. I'm just having a very quick scan through the questions. It looks like everything else that has been popped in so far has had an answer into the Q&A, but if there is anything else, please pop your hand up now and we can hopefully answer it. No? Okay. They're letting us all off very light. So thank you again to everybody. Sorry, Becky.
No, Jen, I was just going to say there is something in the chat. I don't know if this is just about the plans for measuring outcomes.
Okay. Sorry, I was looking at the Q&A.
Yeah, no, I just noticed that in the chat function. So it's just asking about what plans are in place to measure the outcomes expected from introducing the service nationally.
Yep. So I can certainly answer that, Alistair. So we have got a full benefits realisation strategy from a national perspective. The KPIs and metrics have been shared with the key people that we're working with in all the health boards. So that will make sure that we are seeing what we are anticipating to see. It covers usage, so the numbers of practices and GPs that are actually using the application. It covers numbers of referrals that have got images attached. The metrics also cover things such as those ACRT outcomes, so how many patients are not requiring a face-to-face appointment, how many are getting advice and guidance, how many are potentially being triaged straight onto maybe surgery or onto a most appropriate clinic. We are also looking at the sort of waiting times and what impact this pathway is having on that. If there's not as many face-to-face appointments, we should see those waiting times come down. There is roughly about 9 metrics off the top of my head, so we can absolutely share them if anybody's interested, but we are absolutely capturing them. So yes, that's there. I hope that answers your question. And I've just seen another point from Ronnie to say images do not become mandatory. So from a national programme perspective as well, this is not something that we're making mandatory. Anything like any decisions round about mandating of images, etc., would be, if a health board wanted to do that, that's not within the programme to be mandating images. This is a tool to enable, not mandate. Thank you so much. The next webinar for this is the 27th of May, and that is the QFit webinar. The QR code is on the screen for anybody who's interested in registering for the QFit one. Would also love to hear your feedback on today's session. So that is the QR code on the left-hand side of the screen. I know we've thrown a lot of QR codes at you today, but we can share them so that everybody has got them. If anybody does have any follow-up questions, please do feel free to reach out to us. We're always happy to help or answer any questions or attend anything that else you think is helpful. Thank you very much for your time today. And if there's nothing else, I'll let everyone go.
Thanks, everybody.
Thank you.
Thank you.
Thanks very much.